Good afternoon and welcome. I'm Kim Menzel, a clinical social worker with experience working with individuals and families living with food allergies. Today's conversation on food labeling for food allergy families is organized by the Mary H. Weiser Food Allergy Center at the University of Michigan. Today, we will hear from Dr. Steve Gendel, who has over 30 years experience working to protect food safety and public health. Steve has a BS in chemical engineering and a PhD in cell and developmental biology and spent more than 2 decades developing science and policy in the FDA Center for Food Safety and Applied Nutrition. He was the first FDA Food Allergen Coordinator and contributed to the creation of agency policy, guidance documents, and regulations. He's an internationally recognized expert on food allergen management and on safety assessments for new food proteins. Currently, Steve is an independent consultant at Gendel Food Safety, LLC. Welcome, Steve. We look forward to hearing from you about food labeling regulations in the United States, what information they provide, as well as the limitations of labeling when it comes to protecting people with life-threatening food allergies.
Well, thank you for the invitation, and I'm looking forward to answering your questions. I think it's always really important to work with people who are actually affected by these regulations and to try and help them understand what's going on.
I know it is always top of mind for parents and individuals I work with who are, so the parents who are really trying to learn how to best understand labels, choose foods, prepare food safely for their families, but then how they're teaching kids to read labels and what they should be looking for, why they matter, and ultimately always to be able to then live independently and safely with their food allergies. So I know it's top of mind. And first, let's just talk about the latest developments in food labeling. Something that speaks, it's the most pressing concern of people with food allergies is what I'm choosing to eat. Is it safe? Is it safe for me to eat? What do I eat? And what is the FASTER Act? And exactly what did it do? Why does it matter?
So the FASTER Act is the latest update in the allergen labeling laws passed by Congress. And FASTER is an acronym that stands for Food Allergy Safety, Treatment, Education, and Research Act. Congress likes to use fancy names for their laws. It makes some interesting acronyms sometimes. It's got several different parts to it, but the main one of interest in this case is the fact that it modified the list of allergens that in the law are called major food allergens. And the major food allergens are the ones that require labeling in the US. So this law added sesame to the list of major food allergens. So while previously we had 8 major food allergens: milk, egg, fish, shellfish, tree nuts, peanuts, wheat, and soybeans, we now have 9 because sesame is part of that list. And by adding sesame to the list, that means that all of the requirements for allergen labeling that apply to all of the other major food allergens will now apply to sesame. So that's the plain label declaration of the term sesame when it or any of the proteins from it are present in a food. And also, interestingly, what a lot of people perhaps in the industry don't realize is that the food safety regulations for controls for safety, what the agency calls preventive controls, says that industry manufacturers have to have controls for the major food allergens. So industry has been working for a number of years now with the so-called Big Eight, and now they have to go back and look and see, do they have anything with sesame involved? And do they have to modify their control processes to take that into account? So in excuse the expression, nutshell, it's an overview of the major points of what's in FASTER.
So, so on a label, what would someone expect to see? What needs to be labeled? You said if any of the protein of, so soy protein or soy. And so that has to be noted, any of the top 9 now.
That's correct. So the idea was when this was originally put into place, it's the Food Allergen Labeling and Consumer Protection Act, which is getting close to 20 years old now. The idea was to have plain language labeling for any of the major food allergens, the important food allergens on the label. The idea was to take the example of milk that you just mentioned. If a product contained, for instance, casein, would a consumer know that casein is a milk-derived protein? And the answer is maybe, maybe not. So the law says that if you have anything that contains protein from one of these allergens, you have to use the plain English term in the label. So it has to say milk someplace in it. So that what the FASTER Act did is essentially say the same thing now applies to sesame and any products derived from sesame that or anything that contains sesame in them also have to very clearly just say sesame on it. They also what FOCPA did originally is it gave manufacturers a choice of two ways to do the declaration, and one of them is to simply use the term milk, in this case, within the ingredient list. But what they can also do, and what a lot of them do, is put in what's known as a contained statement. So after the ingredient list, they can say contains and then list all of the major food allergens that are in their food. So to use the example we just talked about, the ingredient list might say casein, and then they would have a contained statement that says milk in it. And the same thing would hold true now with sesame or any of the other 8 allergens.
So what has to be labeled? So is it any food that is produced? And so if somebody's eating at a restaurant, it would be, and as we teach people, ask the person who is taking your order, I am allergic to sesame. What can I eat that's safe? So also at a restaurant, they would have labeled, let's say, the oil that they used in the food, as well as the ingredients. So everything has to have a label that, so they know, like, this oil also contains sesame. It more than just what the consumer might buy for themselves at the store.
Yeah,
It
so
impacts.
so the FOCPA and now FASTER, to get into a little bit of legal fine points, only apply to foods regulated by the FDA. So that means foods which are packaged for sale to consumers. So you think of it as being the stuff that you would get at a grocery store, basically, or order online from a large um, online company that sells things, including food and other stuff. That's where the authority of the FDA extends. Interestingly, FOGPA, and I'll get around to answering your question, but I take a little side trip here. FOGPA only applies to FDA regulated foods formally. So foods that are regulated by the USDA, which is meat and poultry and some egg products, technically it doesn't apply directly, but the USDA has adopted regulations that say we're going to also require labeling of the same allergens. So they want to be consistent. And the importance of that comes from the fact that there are some products, and I'll use the example, the classic example of a pizza that contains that may be an FDA regulated product if it's just like a vegetarian pizza, or it could be a USDA regulated product if it's got sausage and pepperoni on it because it's got meat. So in order to make sure consumers had all of the same information regardless, USDA uses the same labeling requirements. Now, to get to your question about what happens at restaurants, the FDA has limited, if any, authority to regulate what happens at retail restaurants in situations like that. So when it comes to knowing what's in the food in the restaurants, there may be some local city, state, county authorities that have regulations, but primarily it's up to the management of the restaurant to know what's going on and to have training and to make sure the people in the restaurant, the servers and others, have training to know what they have in their foods and whatnot. So it's a difficult thing to really know when you're eating out at a restaurant, whether the people who are serving you are well trained and really knowledgeable about what's going on. So the advice that I know a lot of people give to allergic consumers is when you find restaurants that are you can trust and that are really trustworthy, you've got gold. Stick with them. If you go to a place and they hem or haw and they're not sure, don't take a chance. Um, it's we also often tell the restaurant owners and the people who work at them that if they take that tiny bit of little bit extra effort to help sensitive consumers, they have a really loyal audience, customer base that will promote their restaurants and be a big help for them. So it's a value to both when that happens.
Absolutely. Absolutely. So when does faster become effective?
Well, we're right on the threshold of that, actually. The labeling requirements as they were written into the law go into effect on January 1st. So we're what about 7 or 8 weeks away from it becoming effective, right on the edge.
Will labels for all sesame containing foods change immediately?
The chances are that most of them have already started to change. Again, if you get into the legal fine points and the regulatory fine points, the law says that it applies on January 1st to foods, which the technical term is introduced into commerce, into interstate commerce. So some foods are introduced into interstate commerce. So they may, for instance, have been shipped to a warehouse or a distributor and will be distributed over the course of a period of time that goes beyond January. And those, because they were introduced already, don't have to have the labels changed. So there will be a few products where it may be a few weeks before the changeovers all become effective. I know from what I've seen at grocery stores that a number of products have already started to implement the new labeling requirement. So it should be very rapidly coming into effect, but it won't be a sudden thing where things have to be taken off the shelves and so on January 1st.
That's important for people to know is just be observant for the first period of weeks, because if
Right,
something was already on the shelf, it won't pertain.
right, right. And as I say, that the technical terminology of introduced into commerce, there are a lot of products that, especially things with long shelf life, they get produced and then shipped to warehouses or to distributors and then get sent to individual stores according to demand over the course of a number of weeks. So those things are already in legal terms, already in commerce.
Will there be any other changes to the allergen labeling requirements over the next few years?
I don't see any. Frankly, it took a lot of effort on the part of the food allergy community for a number of years now to get the FASTER Act passed. And it's very much a one step at a time situation. Congress, as you know, and as everybody knows, tends to work slowly in these areas. Um, FDA has a lot on its plate, so they're unlikely to do any rulemaking or any changes on their own. Um, on allergens in the short term, especially because in a situation like this, they also have to devote some time and effort to enforcing education and enforcing of industry to make sure that the new rules are implemented. And as a side note, I do want to point out that the food allergic community, the patients, the people, the families involved are a wonderful community. They are knowledgeable, they're active, they're cooperative. One of the reasons they get things like this done is they really work with industry and they work with Congress to accomplish it. They aren't confrontational. They aren't radical. You know, they don't make rash statements. So I think that this is a really wonderful community of people who are really, besides the fact that they have really important concerns, they also know how to go about working out their problems in a really productive way. So I am always impressed with the quality of the community and the people in it.
There's real perseverance
Mhm.
on behalf of like food allergy parents. It seems to really continue to bring up issues, whether it's with the airplane industry, with food labeling, with the restaurant industry and hospitality, to, to continue to move forward so that individuals with food allergies can live independent and enjoyable lives, getting to do all the things that
Yeah.
that you get to do if you don't. It seems to me working with families, I notice just they're doing double duty. So I'm learning about and managing my kids' food allergy, and I'm advocating and educating others to try to help more people understand what this is.
Yes. And also one of the things that's been very impressive is the way the community has worked with medical researchers to understand the development of allergies. But also there's been just amazing developments recently about potential treatments to perhaps not cure allergies, but to reduce the severity of reactions. And that kind of research wouldn't have been possible if the community hadn't advocated for the funding to support the research. But also when the products are starting to get to the market, they have to be tested through clinical trials. And it's a wonderful thing to see people who are willing to participate in clinical trials these days to help develop these therapies or these mitigation treatments. So again, this is something about this community that I think is pretty unique and very impressive.
I'm sure there'll people who will view our conversation today will appreciate that there's recognition from people like you and the work that you do about their part in this. Does the act or anything from the FDA do anything to clarify that meaning of may contain?
So the short answer to that is no. The slightly longer answer to that is that's an issue that's been on the plate for FDA and the industry as well as consumers since FALCPA was initiated. Um, First of all, there's often a lot of confusion about the difference between a statement that says contains and one that says may contain. So a contained statement is the legally required wording when companies use that approach for labeling their allergens. There is no legal requirements or limitations on a may contain or other advisory statements other than the fact that they must be truthful and not misleading. So that's why you see so many different kinds of advisory statements, things like made in a facility that also processes and things like that. So it can be very confusing. There's no doubt about that. Industry is often confused about when is it a good idea to use a label like that? When does it give useful information? Because the law doesn't give FDA authority to regulate voluntary statements other than truthful and non-misleading, there isn't much that they have been able to do in that area. But having said that, what's interesting is on an international scale, this is a worldwide problem. And on an international scale, there's been some efforts that are ongoing in the Food and Agricultural Organization, which is a part of the United Nations. So it's an organization which is part of the UN that is very interested in allergen labeling and allergen labeling issues. And they are actively working with groups of experts to try and figure out, is there a way that we can define when that kind of labeling is appropriate? Is there a way of standardizing the wording so that it's meaningful? So there's efforts going on. And I think that the FDA, well, I know, put it differently, I know that there are at least two people who are current FDA experts working in this area who are part of those conversations. So the agency, of course, is going to be very aware of what's going on, participate in it. And hopefully once it gets to the point where there's some international consensus, that will then feed back into the agency's thinking about maybe some ways they could approach that in the United States.
Is the thought, the may contain could scare people from eating. They could be food items that might be safe for them that they're not eating because the may contain.
Exactly. Yeah, it's
Yeah.
so, some companies will put a may contain statement on just out of self-defense because they can't 100% guarantee that the way they look at it, I can't 100% guarantee there's absolutely no detectable level of some allergen in there. So they feel like this is their way of protecting themselves against lawsuits or other problems. But it's in those cases, it's not useful for consumers and it's not helpful for the company. The problem is there are other situations where it makes perfectly good sense. And I'll use an example that we've seen before, which is in candies. So if when companies make certain kinds of single individual pieces of candy, they use a piece of equipment called an enrober, which is this, like a chocolate waterfall. So the candy passes through this and it gets coated with chocolate. And that chocolate keeps getting recycled and reused. So it can wind up with traces of nuts or other products in the chocolate that probably are not a good idea for allergy consumers to be eating that stuff. The problem is that they don't quite know how to label the fact that it's there. That those things are not, according to FDA's definition, actually ingredients because they're not there on purpose. They're not intended to be there. But the companies can't, because of the nature of the equipment and the nature of the product, they can't get rid of it either. So they're sort of stuck in the middle. And for those companies, being able to put it in a useful advisory statement on their product would be very worthwhile. They face a dilemma though, because so many other companies have used the same wording in a perhaps not so informative way that if a candy company puts it on there, will consumers understand it and will they take it seriously? So it is very much an interesting dilemma.
So is may contain ever used in industry where it's that within the same facility there are different products being made, some that contain some of the top 9? Might they also use? Do they have to use both the shared equipment and the may contain?
So I'll go back to the fact that there is no legal requirement for
Right.
what that says, as long as it is truthful and not misleading. So one of the examples that I've used occasionally is that you could have a statement that says made in the same facility. But what exactly does that mean? So for instance, you could have two production lines for products that are, I don't know, 6 feet apart in the same room, and that's made in the same facility. You could also have those two production lines that are, I don't know, a quarter of a mile apart in different rooms that are still in the same facility. Obviously, the risk for consumers is very different in those cases, but the manufacturer could easily label made in the same facility in those cases. So it's this the advisory label wording and what it means and what's best for informing consumers remains an interesting problem. Um, and it's as people have often said, consumers who are concerned should try to approach the companies involved and try to get a understanding of what exactly it means. But this is another one of those cases where I think a community approach of having the community of concerned consumers work together um, with companies and with other organizations to make some lists of interpretations of these. And I know there are some websites and organizations who do work with manufacturers and will make available lists of products that they will say, we've checked with this manufacturer and this is exactly what their situation is. So this again is a great example of the community working to help themselves, but again, not to be to do it in a positive way with the manufacturers. So not to be confrontational, but to be trying to gather information. And I wish I could tell you that there was a simple answer, um, but there is not. The best answer that people can give is if it has a may contain statement, don't take a chance.
What's the difference between what we think of as the life-threatening food allergies and that labeling, and then when we see gluten-free labeling?
So gluten-free labeling especially in the US, um, is labeling that was designed to that's actually part of the FALCPA Act that the FDA was required to define and permit the use of the term gluten-free. And what that means, what the aim was there was to protect people with celiac disease. Um, they have a different kind of immune mediated reaction than an acute allergy. Um, Technical term is that the kinds of allergies we've been talking about are what's known as IgE mediated allergies. And IgE is a type of antibody. And those are the kinds of allergies that can lead to anaphylaxis and severe immediate reactions. That's the classical allergic reaction. Celiac disease is something which affects the lining of the intestines and tends to be a more chronic problem. It's something which happens, and it's also a very serious problem, but it doesn't induce a immediate anaphylactic reaction. It causes deterioration that's a chronic condition. And just like with the IgE mediated allergies, the best thing that a consumer can do is to avoid exposure to the triggering substance, which in the case of celiac disease is gluten from wheat, rye, and barley. So gluten-free labeling was developed to provide the information for celiac patients about the absence of gluten from wheat, rye, and barley. But the interesting thing is that because of the nature of the problem, it appears that celiac patients, by and large, can be exposed, not perhaps on a regular basis, but occasionally, to low levels of gluten without having permanent difficulties. So the FDA was able to set a threshold for gluten-free labeling, which was 20 parts per million gluten or 20 micrograms per kilogram of gluten, which they can't do for allergic patients because of the nature of the reaction, that the very small amounts cause an immediate reaction. So that's really the difference is that there's they're related in the fact that there's immune mediation involved. They are related in the fact that it's a food sensitivity that consumers have to um, There's no treatment to cure it, and so the consumers need to avoid being exposed to the triggering substance. But beyond that, there's the differences of what happens, and the degree of risk at low levels is quite different. And I guess I should say, if there's an overlap between allergen labeling for wheat and gluten-free labeling, um, for products that contain gluten from wheat. If for patients who have wheat allergies, gluten-free food is not necessarily a safe choice, because it can have some level of gluten protein in it and still be gluten-free. So that's a decision that should be made on a case-by-case basis. As usual, the advice is talk to your doctor, uh, and find out exactly what your doctor says. But in case of doubt, don't take a chance.
Are there foods that are exempt from the food labeling requirements? And what should consumers keep in mind when shopping for them?
So the biggest thing that has an exemption, you talk about the allergen labeling requirements, um, is that Congress wrote into the law, into FALCPA, an exemption for what they call highly refined oils. So these are things like corn oil and soybean oil, soybean being the biggest example, but peanut oil also. These are oils derived from allergenic foods, but they are highly processed. They go through multiple purification steps, and the end result is a product with uh, little or no intact protein in them, probably none. So those things have been tested in some clinical trials that show that they don't cause reactions in consumers. So peanut oil, for instance, should be safe for peanut allergic individuals if it's the highly refined commercial variety. Where you have to be careful is that there's a lot of products on the market, specialty products and so on, which are not highly refined. They might be cold pressed, for instance, or some other uh, specialty product that has not been treated to remove all of those oils. And in those cases, or all those proteins, excuse me, from the oils. And in those cases, they would not be good for an allergic consumer to consume. I know that there are a lot of consumers who think or worry about those oils. Um, but again, I think that that's one of those cases where talking with a good doctor can determine whether that doctor feels that you have a problem or not.
So, if people are buying imported foods, um, jarred items, crackers, candies, packaged goods, are the rules regarding selling imported foods in the US? Is are they held to the same labeling?
Absolutely, absolutely.
Mhm.
Well, they're supposed to be, put it that way. Imported foods, anything sold to consumers in the US must meet the US labeling regulations. And for that matter, all of or the equivalent of the US food safety regulations. But we'll talk about labeling. So they should have all the correct labeling on the packages. Um, so the basic answer to your question is yes, they're held to the same standards. The practicality of it is with the huge amount of specialty foods coming in from countries all over the world, it pays to be a little bit careful to look at the product labels and make sure that they have been put on in compliance with the U.S. labeling regulations. Um, and to not be too repetitive here, but again, the advice is if in doubt, don't.
So, is there any estimate on the prevalence of incidents of incorrect labeling? Is there any, how is that?
Yeah, that's an interesting thing. So um, there is, it's hard to know for sure, but for a number of years now, undeclared allergens have been the leading cause of recalls for FDA regulated foods in the US and in some other countries. I believe the same thing holds true in Australia. I think probably in the United Kingdom. I think perhaps in Canada. It's either the leading cause or one of the top two in all cases. So incorrect labeling happens. It's something that I have worked on and fretted about a lot for the last 10 or 15 years. It's an interesting thing because quite often, surprisingly, I guess I shouldn't say quite often, surprisingly often, it's the result of the right food being put in the wrong package. So somebody might make a almond cookie, for instance, and put it in a package for a similar product that doesn't have almonds in it. Now, the thing about that is that even if you've read the label, of course, and you take the food home, you don't know till you've opened the package. So I think it's really worthwhile for a consumer to know the products that they're eating or buying and to know, what do they look like? What do they smell like? What do they feel like? And if it doesn't seem right, be careful, because mistakes do happen. Um, Most of the recalls that I have seen for this problem will say that there were no known reactions, that they've been caught before something happens. But there are still some that do happen because somebody has eaten the food and had a problem. There are things that go wrong in the production process for foods, and unfortunately, sometimes that results in having an allergen in the wrong place.
Is there a food recall hotline or a website? Where would people report that if they have concerns?
So I think there's two parts to your question. Is if you have a question or a concern, you should absolutely do two things. One is report it to the manufacturer or the place that you purchased it. Um, they may or may not give you a very good answer about what's going on, but if they hear from a lot of people that there's a problem, they'll take it seriously. The other thing is to report it to the FDA if it's an FDA regulated product. If it's a meat product, report it to USDA. If you want to report it to FDA, there's a couple of ways to go about it. The one that I like to recommend is that in every state, there is a consumer outreach coordinator for FDA. And you can get in touch with the coordinator from your state directly. The email addresses and I believe phone numbers for those consumer complaint coordinator is the title, is available on the FDA website. And you can contact them. And it's a very interesting process. So it's not an allergy related problem, but I'll tell you about one that we did in my family not too long ago. Is we had a product, a hot dog on a wooden stick product, and cut the hot dog in half and found what looked like a strange piece of plastic in where the wooden stick was. So wrapped it up in a baggie, stuck in the freezer, and then contacted the consumer complaint coordinator for the product. In this case, it was a USDA product, and exchanged some emails with them, sent them pictures, and they went to the manufacturer and checked it out, and they decided that it was a one-time problem and took care of it. So these coordinators take it seriously. They will go back and check and see if they can find out what's going on. If you've had a reaction to it, you'll want to make sure that FDA is aware of that. They will ask you about whether you, or if you're reporting on the behalf of a child or somebody else, they will want to know all that information. So it's really useful to get this information into FDA. It's really helpful, and I think people don't realize it because the agency is able to keep track of these things on an ongoing basis, and they can see patterns and they can see things happening that as an individual you might not be aware of. Um, Especially nowadays, as things get distributed all over the country, the agency might see something happening, um, like in my state here of Maryland, and something else happening in New York, and something else in Illinois, that as an individual I wouldn't have any way of knowing anything about, but the agency does because they have these data systems to track all that. So the more that they know, the better.
Thank you so much for being with us. And I know all of this information is going to help parents teach their children, and for kids and young adults to learn what they need to know to keep themselves safe and to be able to participate in life fully. So we really appreciate your expertise and you being with us to answer these important questions.
I always enjoy talking about this and trying to help people. As I said, this is a community that's got a lot to be proud of for the things that they've done, and I'm really happy that I can help support their efforts to keep making things better. So thank you.
Thank you so much. And on behalf of the Mary H. Weiser Food Allergy Center here at the University of Michigan, we thank you for being part of our community. And please let us know what topics are on your mind so we can continue to speak to those. Thank you.